If you have an L4-5 disc bulge or an L4-5 disc herniation, these 5 daily moves could be making it worse, and chances are you're doing at least one of them right now. I've treated disc injuries for almost 35 years, and these are the exact mistakes that keep your back pain burning, your buttock area painful, and your leg pain firing all day. But here's what no one tells you. It's not just about bad lifting techniques or sitting with poor posture. These are everyday habits that seem harmless, but they're quietly slowing down your disc bulge healing. In this video, I'll show you exactly what they are and what to do instead to stop aggravating your L4-5 disc bulge or herniation and finally get lasting relief. And be sure to watch right to the end, because mistake number 5 is the one that could be turning your pain chronic, accelerating your disc damage, and even increasing your risk of surgery. Plus, I'll share a simple sleep position that will help relieve sciatica leg pain at night so you can sleep with comfort. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. Mistake number 1 is sitting and resting all day. If someone told you to rest all day because of your disc bulge, they gave you the worst advice possible. Now, don't get me wrong, rest has its place, especially during a flare-up, but sitting and lying around all day is one of the worst things you can do for an L4-5 disc bulge or L4-5 disc herniation. Why? Because sitting increases pressure on the discs in your lower back. And if you're slouched, even just a little bit, it pushes the discs backward into the nerves and triggers shooting pain down the leg. The longer you sit, the more compressed and irritated your injured disc becomes. This can slow healing and aggravate the back and leg pain. Instead, keep your body moving, but gently. Go for short walks throughout the day, even if it's just around the house. Try not to stay in one position for too long. Every 30 minutes, every 60 minutes, 30 ideally, get up, stretch a little, shift around. Even something as simple as standing while folding laundry or doing the dishes, which you may in fact often find difficult to do, can give your spine the break it needs from all that pressure. Small changes like these make a big difference. The only time that you should be lying in bed is if you simply can't get up out of bed, and even then you should still try to make an effort. But sitting isn't the only daily habit making things worse. In fact, the next mistake is something people do automatically without thinking, and it can flare up your disc in just seconds. Mistake number 2 is bending and twisting at the waist. This one catches people off guard because it's something we all do every single day, usually without even thinking about it, and it's one of the fastest ways to aggravate a disc bulge or a disc herniation. Think about how often you bend forward to tie your shoes, pick something up off the floor, grab a laundry basket, or reach in the back seat of your car. If you're bending and twisting at the waist when you have a disc bulge, you're asking for trouble. That movement puts direct pressure on the L4, L5 disc and often forces it further backwards towards the nerve. Add a little twist to it, and now you have torque on the spine, which can trigger sharp pain, muscle spasms, or a full-on flare-up that lasts for days. There's no better way to aggravate the spine than to twist and put pressure on it while you're rotating. When you put extra weight on it, it's how you would want to hurt yourself. Here's what you should do instead. Hinge at your hips, not your waist. Keep your spine straight, bend your knees, and control your movement. If you need to turn, pivot the whole body. Remember, your feet do move. Don't twist from the lower back. These adjustments may feel small, but they take serious strain off the injured disc. Now, if you're thinking, I'll just avoid bending and start jogging instead, don't. The next mistake is one a lot of people turn to for fitness, but it can seriously backfire if you have a disc bulge or disc herniation. Let me show you why. Mistake number 3 is running or jogging. Now, I know what some of you are thinking. Are you kidding? My back's so bad I can't even walk. There are people who still try to run or jog with disc bulges, disc herniations. I work with a lot of athletes and people who exercise regularly, and this is one of the most common questions I get: can I still run if I have a disc bulge? And they don't like my answer. Running might feel like a healthy way to stay active, but if you have an L4-5 disc bulge or an L5-S1 disc bulge or disc herniation, it's often the wrong kind of movement. Every time your foot hits the ground, your spine absorbs that impact. Especially if that disc is already injured and it's pressing on the nerve, then that pounding is only going to make it worse. Even short jogs can aggravate symptoms, lead to inflammation, and slow down the healing process. It's frustrating, especially if running is your go-to exercise for stress relief or staying in shape. But trust me, pushing through the pain here usually leads to setbacks. So what's a better option? Low impact movement, walking, cycling, swimming, or using an elliptical trainer. If it's tolerable for you, these options can help you stay active without putting the same kind of stress on the spine and discs that running does. Now, I know avoiding running is one thing, but what about lifting weights or going to the gym? Well, you're going to hear about that in number 4. So mistake number 4, yes, working out in the gym before the disc is healed. You've heard me talk about this before. It's another very common question I get asked: when can I go back to the gym? And I get it. If you're used to working out, staying out of the gym feels like you're losing progress, but returning too soon can cause more harm than good. The truth is your spine doesn't care how motivated you are. If your L4-5 disc herniation hasn't healed, loading it too early with squats, deadlifts, or even weights or machines can set you back. Just because the pain has subsided or eased up doesn't mean the disc is stable. It's one of the things I talk about all the time. Of all my patients, the ones who typically respond the fastest are my athletes. The ones who relapse the fastest are my athletes, because they go back out doing a sport and not realizing the fact that the pain subsided doesn't mean they're back to the level of function that we want. That early return to lifting can aggravate the healing disc further, irritate the nerve, and more importantly, undo weeks of progress. I've seen this happen with many patients who went back to the gym before they reached full disc recovery. Instead, focus on strengthening your back with core exercises after the injury period. Remember, we never start an injury with core. Start with light activation like bird dogs or prone planks. These are spine-friendly movements that don't create disc compression, and get clearance from your doctor who understands this topic well before adding load to the spine again. But even more dangerous than going back to the gym too soon is doing nothing at all. The next mistake is one I see way too often and can silently turn a mild to moderate disc issue into something far more serious. Let's go there next. Mistake number 5, delaying treatment or waiting it out. I can't tell you how many people I've met who thought, I'll just wait it out. It'll probably go away on its own. Those are the most common words we hear in our clinic. I thought it would go away. And months later, sometimes even years later, they're still in pain. Plus that underlying condition has progressed. Here's the problem with waiting. Disc bulges don't usually fix themselves. For many patients, they just want to get out of pain quickly, and I get that. But the real key is figuring out what's actually causing the disc bulge in the first place. And in many cases, it's not just one cause. It's a combination of multiple underlying causes. You hear me say that over and over and over again. That's why seeing a qualified doctor who has real experience assessing and treating disc conditions is so important. You need to check for spinal misalignments, postural shifts, segmental instabilities, degenerative disc disease, what we call anterior listhesis or retrolisthesis, where the vertebrae literally shifts back and forth, and even sacrum misalignments. All these can be underlying causes of an L4-5 or an L5-S1 disc bulge or disc herniation. And if those aren't corrected, the disc issue, it will keep coming back and turn into something far more serious. We've just covered 5 key things to avoid and what to do instead during your waking hours. But what about when you're sleeping? That's where this unique sleep position comes in. It's called the 90-90 sleep position, and here's how you do it. You lie flat on your back and place a stack of pillows under your legs so that your hips and knees are both bent roughly at 90 degrees. Make sure the lower legs are flat like you're sitting in a chair, but lying on your back. That might need several pillows. It's going to look strange. It works very nicely. The 90-90 sleep position takes pressure off the lower back by flattening and relaxing the lumbar curve. This reduces compression on the L4, L5 disc, and can also reduce pressure on the spinal nerve that triggers leg pain. As a result, both back pain and leg pain often ease up, sometimes within minutes. The 90-90 sleep position may help calm down muscle tension in the hips and lower back. For many people, this sleep position may finally provide a way they can fall asleep and stay asleep comfortably without tossing and turning all night. If you've been waking up stiff, sore, or still in pain, try the 90-90 sleep position tonight. It might just help you get a better night's sleep and wake up with less leg pain in the morning. Today you learn the 5 worst things you can do if you have an L4-5, L5 disc bulge or disc herniation. Same for L5-S1. These simple corrections can take pressure off your injured discs, reduce nerve irritation, and help you finally start feeling better. You also got a bonus sleep position that can ease back and leg pain while you sleep, or in fact just even rest. Give these changes a try and see how your body responds, and let me know in the comments which daily habit do you think has been causing you the most trouble. If you got value from this video, go ahead and like it and share it so more people struggling with disc pain can get the help they need. Subscribe if you want more tips and strategies on how to treat and relieve debilitating back and neck pain without relying on drugs or surgery. And if you want to see how we get on average a 90% plus success rate in treating L4-5 disc bulges and herniations using our unique 7-step neurospinal restoration program, go watch this video next.